And then environmental triggers, substances can cause cardiac arrest. And then, of course, I know this is kind of something that we've all been kind of talking about and speculating. And, I want to put that out as well, that we do not know the cause of his arrest. But, there's been a lot of chatter about commotio cordis, which is basically an event where you have a high velocity impact to the chest right when the heart kind of finishes contracting within this very small window of time, like 20 to 40 milliseconds, where that impact can actually trigger an abnormal heart rhythm or a ventricular rhythm that can cause cardiac arrest. So there's a number of things that we think about, some more common than others. And again, common in quotes, because cardiac arrest in itself is very rare, particularly out on the field, but a lot of things that we want to consider.
So it's commotio coitus, is that it?
Cordis.
Cordis. Okay, so that right there, is that something that we see a lot in athletes, or is that more on the rare spectrum? Because I've heard, and you obviously would know more than I would, that that's something maybe you see in a baseball player, not a football player.
It's
Is that
incredibly
true?
rare. I mean, we're talking about, yeah, it's rare. Maybe one in, sorry, not one in, but maybe about 10 to 20 cases a year, perhaps. And yeah, we usually will see it more so in sports where we're thinking and seeing high velocity impact, right? So baseball, or lacrosse or hockey, those are the types of sports we consider. Could it happen with physical impact? Yes, it could. But again, it really is a diagnosis of exclusion when we're thinking about the cause of cardiac arrest. So what I mean by that is it's one of the last things that we consider after we've excluded much more common things that can cause what happened to Demar.
Yeah, I mean, and I do want to talk about, he's down for nine or 10 minutes on the field, receiving CPR. How crucial is it that the medical professionals, the paramedics, and the doctors, they got to him immediately and began performing CPR?
Incredibly crucial. I mean, here, time, seconds, and minutes matter. And those minutes can be the difference between improving your neurologic function or losing it completely, as we can see, with the most recent media letting us know that it seems like he's neurologically intact. So you immediately want to get on the field. You want to check for a pulse, see if the person is breathing, start immediate chest compressions, get an automated external defibrillator, which just tells you exactly what to do, whether you can shock the person to get them back into a normal rhythm or quote unquote resuscitate them. But even after 4 minutes of just not even getting oxygen to your brain, to your vital organs, that can really cost you neurologic function, cause cardiac damage, and ultimately death. So there's a reason behind developing emergency action plans, particularly for all of our sports activities, to make sure that we have a process where medical experts can get out onto the field in an appropriate period of time and act efficiently and quickly like they did in his case.
Yeah, it's incredible to watch the way they all came together immediately. Bengals staff, Bills staff, the paramedics sitting nearby in an ambulance, and made sure that that they were able to restore that heartbeat. So that happened Wednesday or Monday night, excuse me. That happened Monday night. It's been a little over 48 hours right now. How crucial is that first 48 to 72 hour time period when you're dealing with cardiac arrest?
It's incredibly crucial. I mean, the first thing we want to do is make sure that he's electrically stable so that his heart rhythm is stable. He's not going in and out of an abnormal heart rhythm, because the more times that happens, the more chances there are of, again, having poor oxygenation to your vital organs, to your body. So you want to ensure electrical stability. You really want to start thinking about what actually caused it so you can prevent it from recurring if that could happen. If he has any other sort of damage, so if he's having difficulty oxygenating, if his lungs are filled with fluid, or if there's other complications that you're seeing, then you want to treat those appropriately. So sometimes also in individuals who arrest, particularly if they are remaining unconscious, to preserve neurologic function, we can elicit something called a hypothermia protocol, which is basically a way to cool the body to preserve neurologic function, to kind of like let the body quote unquote rest a little bit. And that usually takes about 24 hours. And after that, you can rewarm the person. And oftentimes, like I said, you can really save neurologic function. And that's vital here.
CPR is a very violent motion. I mean, it isn't soft like we see on TV. It isn't soft like we see in movies. My parents are medical, and I can tell after they returned home when I was younger and they had ran a code. What kind of damage is possible to sustain in the lung portion? Because I heard that Demar Hamlin's uncle said that he was laying flat on his stomach while in the hospital bed. Why is that important for him to lay flat on his stomach for his lungs to work properly?
Mhm. So with cardiac arrest, everything essentially stops. So the purpose of chest compressions is to essentially help pump the blood to the rest of the body. Inherently, that's not going to be as effective as if the heart was doing it itself. And what can happen is you can develop fluid in the lungs, and that's probably the most common cause of having issues with oxygenation. And prone positioning actually can improve oxygenation, help the person, breathe better, even if they're ventilated. With respect to the damage that chest compressions can cause, I mean, the most common thing is causing rib fractures, maybe even sometimes breaking the breastbone or the sternum. But I always say, like, we can fix fractures. Fractures will heal. Ultimately, the point of chest compressions is to prevent someone from dying. So even if it looks violent, even if it looks scary, do not be afraid to push to that depth, about 2 inches or so, to really make sure that you're helping that heart pump blood out to the rest of the body.
I hope if this showed anyone anything over the last 3 or 4 days, I hope that it encourages people to want to get CPR certified. I mean, wouldn't you agree that that's one of the most vital and important things that you could do is get CPR certified?
Oh, incredibly important. I mean, I agree with you. I think moments like this, we're all obviously interested in knowing about what's going on with him and what are the new updates. But this is truly an educational moment. Getting CPR certified or CPR trained, being comfortable with using an external defibrillator, those things can save lives. And, these situations, cardiac arrest, happen every day. We see it in the hospital, we see it out on the streets, we sometimes hear stories of seeing someone go down and starting chest compressions. They really do save lives. So I encourage everybody, whether you're an athlete, whether you're a coach, whether you're anybody, a person, just learning those techniques and those tools. It's really easy. It's really quick. Get comfortable with doing it, so that when you are in that situation, you could be that person who could save someone's life.
Yeah, and I think that's very vital. You never know where it could happen because heart attacks, cardiac arrest, anything like that, it doesn't discriminate. Young, old, black, white. I mean, it could happen anywhere, any time of the day to whoever. Before we do go, I know that there's a lot of speculation and conspiracy theories floating around social media right now. And I would like to ask your medical opinion on this if you're okay answering it. I have people who are saying, Jordan, you're a journalist. You need to report that Demar Hamlin was vaccinated. He received the vaccine. That's what did this. Would that have any impact on a healthy 24-year-old suffering cardiac arrest after being hit in the chest?
Yeah, again, it would really be speculation on my part. From what we do know about the COVID vaccine is that it is far more beneficial from a population perspective than risky. If we're talking about a demographic where there could be maybe some incidence of something cardiac related, it is extremely rare. I mean, I think on the order of 1 in 40 or 400 million males, yes, within this demographic of maybe early mid 20s or so, but these are few cases. I highly think it's very unlikely that this was the case for Damar, but it really is speculation. We have so many more common causes of cardiac arrest. This is not the first time we've seen cardiac arrest in an athlete, nor is it going to be the last time. And yeah, I think to make that association would be extremely inappropriate.
Yeah, and that's one thing that I'm like, all right, if people are going to pose this question, I'm going to at least try to ask it and see what someone that with a real medical degree would have to say about it, not a Facebook medical degree. Doctor, we really appreciate it. Dr. Tamana Singh for coming on, taking time away from your very busy day at Cleveland Clinic. Thank you so much for breaking all of this down for us.
Of course, thanks for having me.